Welcome to today's discussion on esophageal ulcers. We'll explore what these ulcers are, what causes them, how they affect your body, and what can be done to treat and prevent them. This informative journey will provide you with a comprehensive understanding of this condition. Esophageal ulcers are primarily caused by damage to the lining of the esophagus. One of the most common culprits is prolonged exposure to stomach acid. This often happens in individuals with gastroesophageal reflux disease, or GERD, where stomach acid frequently flows back up into the esophagus. Another major cause is infection with Helicobacter pylori, the same bacteria responsible for many stomach ulcers. Certain medications, especially NSAIDs like ibuprofen or aspirin, can also erode the esophageal lining. Less common causes include radiation therapy to the chest, certain viral infections like herpes simplex virus or cytomegalovirus, especially in immunocompromised individuals, and physical injury to the esophagus. The pathophysiology of esophageal ulcers is a process of erosion and inflammation. Normally, the esophageal lining is protected by several mechanisms, including mucus secretion and rapid cell turnover. However, when these protective mechanisms are overwhelmed by factors like excessive stomach acid or NSAID use, the esophageal lining begins to break down. The repeated exposure to irritants causes inflammation, known as esophagitis. Over time, this inflammation can lead to the formation of open sores, or ulcers, in the esophageal lining. These ulcers can vary in size and depth, and their presence disrupts the normal function of the esophagus, leading to various symptoms. Esophageal ulcers affect a significant portion of the population, though exact figures can vary. GERD, a major risk factor, is incredibly common, affecting approximately 20% of adults in Western countries. The prevalence of H. pylori infection also plays a role, as it is more common in developing countries and certain demographic groups. Factors like age, smoking, alcohol consumption, and the use of NSAIDs increase the risk of developing esophageal ulcers. Understanding these epidemiological trends helps in identifying individuals at higher risk and implementing preventive measures. The symptoms of esophageal ulcers can be quite uncomfortable. The most common symptom is a burning sensation in the chest, often referred to as heartburn. People may also experience pain when swallowing, known as adenophagia, or difficulty swallowing, or dysphagia. Some individuals may feel a sensation of food being stuck in their throat. In more severe cases, ulcers can lead to vomiting blood, or hematemesis, or passing dark, tarry stools, known as melena, indicating bleeding in the upper gastrointestinal tract. In some cases, chest pain may mimic heart problems, so it's crucial to seek prompt medical attention. Diagnosing esophageal ulcers typically involves a combination of methods. The most common and accurate test is an esophagogastroduodenoscopy, or EGD, also known as an upper endoscopy. This procedure involves inserting a thin, flexible tube with a camera attached down the esophagus, allowing the doctor to directly visualize the esophageal lining and identify any ulcers or abnormalities. During the endoscopy, biopsies can be taken to test for H. pylori infection or to rule out other conditions like cancer. A barium swallow study, where the patient drinks a contrast solution and X-rays are taken, can also be used, though it's less sensitive than endoscopy. In some cases, esophageal pH monitoring can be performed to assess the severity of acid reflux. Esophageal ulcers can be broadly classified based on their cause and severity. Some classifications refer to the location of the ulcer, such as lower esophageal ulcers, which are common in GERD. Other classifications focus on the size and depth of the ulcer, ranging from superficial erosions to deep, penetrating ulcers. Additionally, ulcers can be classified as benign, meaning non-cancerous, or malignant, which could indicate esophageal cancer. Knowing the classification of the ulcer is crucial in determining the appropriate treatment plan. The treatment of esophageal ulcers focuses on reducing acid production, protecting the esophageal lining, and addressing any underlying causes. Proton pump inhibitors, or PPIs, are the primary medication used to suppress acid production in the stomach, allowing the esophagus to heal. H2 receptor antagonists are another class of medications that also reduce acid production, but they are generally less potent than PPIs. Antacids can provide temporary relief by neutralizing stomach acid. If H. pylori infection is present, antibiotics will be prescribed to eradicate the bacteria. In severe cases, especially those involving bleeding or perforation, surgery may be necessary. Lifestyle modifications, such as avoiding trigger foods, elevating the head of the bed, and quitting smoking, are also essential for healing and preventing recurrence. Preventing esophageal ulcers involves addressing the underlying risk factors, maintaining a healthy weight, avoiding large meals, and not lying down immediately after eating can help reduce acid reflux. Limiting alcohol consumption and quitting smoking are also important. If you need to take NSAIDs regularly, talk to your doctor about alternative pain management options or taking medications to protect your stomach lining. If you experience frequent heartburn or other symptoms of GERD, seek medical attention early to prevent the development of ulcers. Getting tested and treated for H. pylori infection can also prevent ulcers. The prognosis for esophageal ulcers is generally good with appropriate treatment. Most ulcers will heal within a few weeks to months with medication and lifestyle changes. However, without treatment, ulcers can lead to complications such as bleeding, scarring, and strictures, which can narrow the esophagus and make swallowing difficult. In rare cases, chronic inflammation from untreated ulcers can increase the risk of esophageal cancer. Recent research focuses on developing more effective and targeted therapies for GERD and H. pylori infection. Additionally, advancements in endoscopic techniques allow for more precise diagnosis and treatment of esophageal ulcers, including minimally invasive surgical options.